يلا.
Good evening. My lecture is about experimental antivirals in COVID-19. The coronavirus or COVID-19, what is it? It is a strain of the same zoonotic virus as SARS-CoV-1, which affected 8,000 people in 2002 and 2003. 96% match between bats and humans. Probably it has reached humans directly or indirectly through a still unknown intermediate host. The virus made up of 4 proteins and strands of RNA. One protein is the spike, providing the crown-like appearance. 2 proteins to provide structural integrity and protection. A fourth protein, which is a scaffold around the genetic material. هذا شكل الفيروس. هذول الأربع أنواع مال الفيروس مال proteins of the virus. Envelope protein, membrane protein, and spike proteins. Which characteristic of COVID-19? The characteristic, highly transmissible. One patient may infect 1.6 to 2.4 other people. طبعا هم young people far more likely to be infected حيعتبرون carrier, but old people more likely to die. Under 40 is around 0.2% to 0.8%. Fatality rate in the 17th is 4 times larger. Men are more likely to get infected than women. It enters through the nose, mouth, or eyes. It's preferentially, but not exclusively, attack via ACE2, angiotensin converting receptors, several cells of the respiratory tract. هذول الريسبتورات موجودين بالrespiratory tract, also in the brain, heart, gastrointestinal tract. It fuses with the cells, releases its RNA, and the hijacked infected cells start to produce protein according to the virus instructions, aimed at reproducing millions of viruses. The infected cells will eventually die from lysis or apoptosis, causing inflammation. Sometimes the immune system can overreact. The virus is then expelled through coughing and sneezing, leading to direct human contagion or indirect through contaminated surfaces. Each infected cells can release millions of copies of the virus before dying. هذه هنا حنشوف شلون يسوون السواب. هي طبعا classical swabs of the patient. هيك يكون طريقة. Why does it spread so rapidly? It is less pathogenic than other coronaviruses. MERS or SARS, with a death rate between 2% to 8%. For the others, it was around 35%. Thus, several cases are asymptomatic and undetected. A significant amount of the spread is fueled by silent transmission from positive asymptomatic. This is the reason for social isolation and lockdown. Different from SARS, COVID-19 is also infectious in the incubation and subclinical phase. It survives in the air for up to 3 hours, but longer in case of heavy pollution, 4 hours on copper, up to 12 to 24 hours on cupboard, or 2 days on plastic, but with the lower virus load, and here the importance of hand washing. It can be inactivated by surface disinfection with ethanol, hydrogen peroxidase. Fecal-oral transmission also seems to be possible, but rare. Symptoms may develop in 2 days to 2 weeks following exposure to the virus. The mean incubation period, 5 days, and that 97.5% of individuals who develop symptoms did within 11.5 days of infection. The classical symptoms indicate COVID-19, fever or chills, cough, shortness of breath with difficulty in breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Other reported symptoms have included the following: sputum production, malaise, respiratory distress, neurological, which include headache and altered mentality. Asymptomatic infections have been reported, but the incidence is unknown. Clinicians evaluating patients with fever and acute respiratory illness should obtain information regarding travel history or exposure to an individuals who recently returned from a country with a coronavirus outbreak. Here we have risk factors for severe COVID-19, regardless of age, include the following: chronic kidney disease, COPD, immune-compromised state due to solid organ transplant, obesity with the BMI more than or equal to 30, serious heart conditions like heart failure, coronary artery disease, and cardiomyopathy, sickle cell disease, and diabetes, which is either type 1 or type 2. نجي هسه على underlying condition that may represent an increased risk of severe COVID-19. Asthma, moderate to severe, cerebrovascular disease, cystic fibrosis, immunocompromised state, neurological conditions, liver disease, pregnancy, pulmonary fibrosis, smoking, and thalassemia. Complications of COVID-19, reported complications have include pneumonia, acute respiratory distress syndrome, cardiac injury, arrhythmia, septic shock, liver dysfunction, acute kidney injury, and multi-organ failure. How is the approach considerations? The FDA now recommends the nasal swab that access just the front of the nose to be used in symptomatic patients, allowing for a more comfortable and simplified collection method and self-collection at the collection sites. The Infectious Disease Society of America has also issued testing recommendations in the term of tier-based priority groups. قسموهم إلى 4 مجاميع أو 4 جروبات على حسب البرايورتي. According to Infectious Disease Society of America, the following patient should be considered highest priority for testing. And 5 type of patients who are highest priority for testing. 1, patients who are critically ill or have unexplained viral pneumonia or respiratory failure. Individuals with fever or signs and symptoms of lower respiratory tract illness who have had close contact with an individual with laboratory finding COVID-19 within 14 days of symptom onset and who have traveled within 14 days of symptoms onset to area where sustained community transmission has been reported and who are immunosuppressed or older or having underlying chronic health issues and who are critical for the pandemic response, including healthcare workers, public health officials, and other essential leaders. هذول يعتبرون highest priority for testing. The second priority include symptomatic residents of long-term care and hospitalized patients not in the ICU. The third priority testing include those being treated in outpatient setting, who met criteria for influenza testing include persons with certain comorbidities like diabetes, COPD, congestive heart failure. The fourth priority include persons who are undergoing monitoring for data collection and epidemiological studies by health authorities. Which laboratory signature of COVID-19? How to make a diagnosis of COVID-19? For the diagnosis, the mild classical symptoms include lymphopenia or leukocytosis with elevated PCR, LDH, and D-dimer. نجي هسه على rapid progression to respiratory distress syndrome and multi-organ failure. بالنسبة للبروجنوسيس راح نعتمد على الهاي ferritin, high troponin and CPK, increased prothrombin time, high liver enzymes like AST and ALT, and signs of acute kidney failure. بالنسبة للدراجز قسموها إلى 8 أقسام. الانتي انفلاماتوري which is the general action تشمل chloroquine 500 mg and hydroxychloroquine 400 mg. possibly beneficial but unproved. راح نحكي على احنا اكثر شيء راح نركز بهاي المحاضرة على الانتي انفلاماتوري and antimicrobial. Antiretrovirals, inhibitors of protease, risk of acute toxicity does not justify their use like ritonavir or lopinavir. Antimicrobials like inhibitors of RNA polymerase, which include ribavirin, remdesivir, and flavipiravir. Anticytokine inhibitors of interleukins, useful to reduce the cytokine storm under evaluation. هذول هم الانتي سايتوكينز. هم عندنا مش مثل توسيلوزوماب and saliromab. Other drugs, corticosteroid to reduce lung inflammation, cortisone, and others like methylprednisolone, very controversial. Antithrombotic to reduce the risk of pulmonary embolism like heparin, enoxaparin, promising either all the drugs are under evaluation. The only يعني هسه بعدين نجي نحكيهم اللي هم ال FDA approved هذول كلهم يعني ما يعتبرون انه FDA approved. Immunoglobulin to improve immunity, convalescent plasma or hyperimmune immunoglobulin. Stop of anti-RAS to contrast virus penetration, which is AC inhibitors and Arab group should not be stopped. Initially considered but no evidence. كلها ما بيها evidence. هنا عندنا guideline, national guideline for management and treatment of COVID-19. We divide it into mild, moderate, severe, and critical. The mild include upper respiratory tract infection. المانجمنت مالتها حتكون supportive, antiviral اللي هي favipiravir and antibiotics. Moderate pneumonia هم رح نعالجها with the supportive treatment, antiviral, antibiotic, and plasma if autosaturation decreased. Anticoagulant as a prophylactic in moderate cases. In severe cases, the same, but we add steroids and anticoagulant at a therapeutic dose. Critical, those who need ventilatory support and tocilizumab. بالنسبة للأنتيبايوتكس اللي إحنا نحتاجها بحالة upper respiratory tract infection الازيثرومايسين، بحالة النيمونيا سيفترايكزون أو مورابينم. بالنسبة للأنتيكوأجلانت يستخدمون الإكليكسان 4000 إلى 8000، طبعاً هاي الدوز adjusted حسب الكيس. ستيرويد ديكساميثازون 6 ملغ IV or methylprednisolone. هذه مال هذا طبعاً الجايد لاين محضرة يعني بروفيسور صباح of كركوك ميديكال كولج. هسه نجي نحكي على الهيدروكسي كلوروكوين اند كلوروكوين وليش صار عليه هوايه ضجه؟ لانه بيه هوايه ستاديز وبيه هوايه ابلكيشنز وبيه هوايه ثيوريز. رح نجي ناخذها واحده واحده. Hydroxychloroquine and chloroquine are widely used anti-malarial drugs that elicit immune modulatory effect and are therefore also used to treat autoimmune condition like systemic lupus erythematosus and rheumatoid arthritis. As inhibitors of heme polymerase, they are also believed to have additional antiviral activity via alkalinization of the phagolysosome, which inhibit the pH-dependent steps of viral replication. This is the mechanism of action antiviral drug. On June 15, 2020, the FDA revoked the emergency use authorization for hydroxychloroquine and chloroquine, denoted the strategic national stockpile to be used to treat a certain hospitalized patient with COVID-19. Based on its ongoing analysis of the EUA and emerging scientific data, the FDA determined that hydroxychloroquine is unlikely to be effective in treating COVID-19 patients for authorized uses in the EUA. Additionally, in the light of ongoing serious cardiac adverse event and other potential serious adverse effect, the known and potential benefit of hydroxychloroquine no longer outweigh the known and potential risk for the EUA. هاي بالنسبة لجماعة ال FDA. While additional clinical trials may continue to evaluate potential benefit, the FDA determined the EUA was no longer appropriate. بالنسبة للhydroxychloroquine. Published reports stemming from the worldwide outbreak of COVID-19 have evaluated the potential usefulness of these drugs in controlling cytokine release. اكو قسم من الريسيرش كان لهم علاقه بالسيتوكين ريليز سيندروم in critically ill patient، هم شافوا انه هو with no benefit. باليو كي شافوا انه الاند بوينت of 28 days mortality بحاله استخدام hydroxychloroquine versus the usual care, also no evidence of beneficial effect. In Brazil يعني سووا تيست انه شافوا no improvement بالبيشنت اللي هم عندهم mild to moderate COVID-19 انه the use of hydroxychloroquine alone or with azithromycin did not improve clinical status at 15 days compared to the standard care. Prolonged QT interval and elevated liver enzymes were more common in patients receiving hydroxychloroquine alone or with azithromycin than those with no treatment or not receiving agents. هنا the French researchers شافوا انه they talked about something about the viral load. The French researchers continue their practice of using hydroxychloroquine plus azithromycin in patients with at least 6 days of follow-up. A favorable outcome was defined as not requiring aggressive oxygen therapy or transfer to the ICU after 3 days of treatment. بس هم نفس الشيء انه هذه شافوا بعدين انه هذول البيشنتس اول شيء هم ما عندهم يعني داتا كافيه والامريكان عرضوها ف يعني بقت هذا الموضوع هم controversy بالنسبه للفيرال لود والافكت مال azithromycin on the viral load. As a conclusion, hydroxychloroquine alone, azithromycin alone, or combination has 1. No significant difference in the primary endpoint of 28 days mortality. Prolonged QT interval and elevated liver enzyme levels were more common in patients receiving hydroxychloroquine alone or with azithromycin than those who were not receiving either agents. No evidence that hydroxychloroquine with or without azithromycin reduce the risk of mechanical ventilation and that the overall mortality rate was increased with hydroxychloroquine treatment. An increased 30 days risk of cardiovascular mortality, chest pain, angina, and heart failure was observed with the addition of azithromycin to hydroxychloroquine. So, because of this finding, the WHO paused the hydroxychloroquine arm of solidarity trials and then removed its use entirely as of July 4th, 2020. نجي هسه على الدراج الوحيد اللي هو FDA approved اللي هو الريمديسيفير. شلون يشتغل؟ هو أول شيء broad spectrum of antiviral activity against many viruses like Ebola, Nipah, respiratory syncytial virus family, and diverse category of coronavirus, including SARS-CoV and MERS-CoV. It's a nucleotide analog prodrug. The molecular mechanism is unknown, but it's thought that the triphosphate form of RDV, that's to say RDV triphosphate, is being used as substrate for many viral DNA-dependent RNA polymerase complexes and has been reported to inhibit the viral RNA synthesis by a specific mechanism of delay chain termination for all these three coronaviruses, MERS-CoV, SARS-CoV, and SARS-CoV-2. هسه رح نشوف
دكتورة سارة بزحمة دكتورة سارة اكو طلاب يريدون يدخلون ترى يعني should admit them.
اوكي.
اكو هسه لو دوسين participant اكو ناس waiting to be
اوكي
admitted اي admit all حتى يدخلون. ايه اوكي very good كملي.
بس مدى عند المين contacts لا شلون؟
اكو participant دكتورة سارة.
اوكي
participants اي
شفته.
اكو ناس waiting حتى يدخلون. يلا. اوكي keep going دكتورة سارة.
بس عندي مشكلة بالكونكشن بس just a minute. المفروض هسه عندت لهم اوكي ما اعرف انه دخلوا لا. اوكي عمو.
يمك تبين اوكي
تمام. زين. سوري. هسه نجي على قلنا الريمديسيفير شلون حيشتغل. هاي هنا هذا المخطط راح يبين لنا شلون حيشتغل. احنا قلنا سارس كوفيد يدخل على السيل ممبرين فشي يسوي راح يطلع ان الفيرال ار ان اي ريليز فيصير ار ان اي انكوتينج اند جينوميك ار ان اي راح يطلع راح يصير ار ان اي ديبندنت ار ان اي بوليمريز. ريمديسيفير راح يقطع هاي السلسله او هاي تشين ويمنع الار ان اي سينثيسيس. اوكي The emergency use authorization allows treatment of adult and pediatric patients hospitalized with suspected and laboratory confirmed COVID-19 for whom an IV medication is clinically appropriate. May the 1st, in 2020, the FDA has granted an emergency use authorization for remdesivir to treat hospitalized adults and children with suspected or laboratory confirmed SARS-CoV-2 infection and severe COVID-19 disease. That's to say, saturation or SpO2 less than or equal 94% on room air, or requiring supplemental oxygen, or requiring mechanical ventilation, or requiring ECMO. August 28, 2020, the FDA expanded the EUA to include a moderate COVID-19 disease. That's to say, this allows use in all hospitalized patients with a confirmed or suspected COVID-19 regardless of oxygen status. بالبداية كانوا عندهم كرايتيريا معينة انه بس اللي عندهم السيفير كوفيد ديزيز، بعدين شملت بعدين باليوم 28 أغسطس صارت على السيفير moderate patients also. Optimal treatment duration is unknown. For EUA, dosage as follows. طبعا احنا نقص اذا الوزن كان اكثر من 40 كيلوغرام راح نقسمها الى patient requiring بالنسبه للدوزز for patient requiring mechanical ventilation or ECMO and patient who does not require mechanical ventilation or ECMO. Day 1 loading dose 200 milligram IV infused over 30 to 120 minutes. Then day 2 to 10 maintenance dose 100 milligram IV 4 times per day. The patient does not need or require mechanical ventilation or ECMO. Day 1 loading dose نفس الشيء هم 200 milligram IV infused over 30 to 120 minutes. Then هنا التايم حيختلف. Day 2 to 5 بالنسبة لما يحتاجون mechanical ventilation حيكون الدوز هم 100 ملغرام 4 مرات باليوم. If clinical improvement not demonstrated, treatment may be extended for up to 5 additional days. يعني إذا دول جماعة الميكانيكال ventilation إذا صار عندهم مشكلة وماكو improvement نقدر نمدد 5 أيام أخرى. Dosage modification بالنسبة للrenal impairment and hepatic impairment. Pharmacokinetics have not been evaluated in patients with renal impairment. Use in patients with renal impairment is based on potential risk and potential benefit consideration. راح نعتمد على glomerular filtration rate. If it's more than or equal 30 ml per minute, no dose adjustment needed. But if it's less than 30 ml per minute, not recommended unless the potential benefit outweigh potential risk. Sulfan-butyl ether beta cyclodextrine sodium salt excipient in concentrated solution is renally cleared and accumulate in patients with decreased renal function. فبيجي حالة use only lyophilized powder product if prescribed. بالنسبة لhepatic impairment not evaluated, unknown if dosage adjusted required. Use only if potential benefit outweigh risk. Other early stage investigational antiviral هو الfavipiravir is an oral antiviral approved for the treatment of influenza in Japan and is approved in Russia for treatment of COVID-19. Favipiravir selectively inhibits RNA polymerase, which is necessary for viral replication. In the United States, phase 2 trial will enroll approximately 50 patients with COVID-19 in July 2020 to test whether the drug can reduce symptoms and viral shedding in people with COVID-19. Additionally, phase 2 trial in Canada and the US is planned to evaluate favipiravir as a prophylaxis for long-term care facilities experiencing a COVID outbreak. Dose مال favipiravir it is tab and the dosage is 1,600 milligram twice a day on the first day, that's the loading dose, followed by 600 milligram per dose twice a day up to 10 days. Another antiviral is the nitazoxanide extended release tablets inhibit replication of a broad range of respiratory viruses in cell cultures, including SARS-CoV-2. Two phase 3 trials for prevention of COVID are being initiated in high risk population, including elderly residents of long-term care facilities and healthcare workers. In addition to the prevention studies, a third trial for early treatment of COVID-19 is planned. Another multi-center randomized double-blind phase 3 study was initiated in August 2020 for treatment of people aged 12 years or older with fever and respiratory symptoms consistent with COVID-19. Efficacy analysis will examine those participants who have laboratory confirmed SARS-CoV infection. عندنا هسه يعني هذا مو انتي فايرال وانما انتي باراسايتيك اللي هو الافرمكتين showed in vitro reduction of viral RNA in vivo H-SLAM cells 2 hours post-infection with SARS-CoV clinical isolation in Australia 2020. The authors note that the preliminary study does not translate to human use, and the effective dose is not established at this early stage of discovery. More research is needed to determine if an antiviral effect would be elicited in humans, as the concentration tested were much higher than that is achieved from the normal oral dose. هذول الدراجز عمولين هم هذول الدراجز اللي احنا حكينا عنهم بس انه يعني ك الاف دي اي ابروفد هم الوحيد الموجود هو الريميديسيفير والفافيبرافير مو اف دي اي ابروفد. نبقى هسه احنا عندنا سؤال مهم انه يعني انه بالنسبه للاطفال اللي هم ينولدون, does a newborn of a mother with a positive COVID-19 need a nasopharyngeal swab upon delivery? If yes, when should it be done? Infant born to a mother with a confirmed or suspected COVID-19 should be bathed after birth to remove virus potentially present on skin surface. Obtain either a single swab of the nasopharynx or a single swab of the throat, followed by the nasopharynx, or 2 separate swabs from each of these sites, and submit for a single test. The specifics of testing will depend on the requirement of local testing platform. Some centers have transmitted to swab of the anterior nares. Testing should be done first at approximately 24 hours of age and again at approximately 48 hours of age. Some infants have had a negative test at 24 hours only to have a positive test at later time. If it's planned that a healthy newborn will be discharged prior to 48 hours of the age. هاي بالنسبة للchildren, a newborn of COVID positive mothers. Thank you. Any question?
يلا عاشت ايدك دكتورة سارة.
هو الموضوع محير
محاضرة قيمة وحلوة.
بس يعني هو الشيء الوحيد
صح.
اللي هو approved هو الريميديسيفير وفافيبرافير احنا بدنا نستخدمه بالعراق, والريميديسيفير بدنا يستخدموه باليو اس اي اضافه للكورتيكوستيرويدز والانتي كواجولانت.
تمام. هو بالحقيقة الريميديسفير هسه دي يستعمل all over the world, يعني من أخذ ال FDA approval بكل العالم ده يستخدم, يعني حتى عندنا بالعراق ده يستخدم بالإمارات بيوروب باستراليا بالعالم كله. الفافيبرافير بعد ما أخذ ال FDA approval بس هم دخل بالاستعمال نتيجة أنه يعني حقق good result وبعد الستاديز بعدها ما كاملة. تمام. احنا هسه اذا اكو اي سؤال من الاخوان, اي سؤال اذا اكو ممكن اي شخص اذا عنده اي سؤال.
نعم عمي ليلى.
العفو يا زين, تفضل
حبيبي عمي يزن ميعاد مركز قلبه. العفو عمي سارة, عاشت ايدك على التقديم. هنا الريميديسفير قلتي FDA approved, بس يعني هم خلوا شرط انه ما ينطي الا اذا كان البيشنت ديساتوريتد او ادميتد تو هوسبيتال.
هو بالبدايه دكتور يزن بالبدايه قالوا انه هو بالنسبه للسيفير كيسز بعدين وراها نزل يعني انه اذا هو ديساتوريتد انه هم طبعا تعرفوا يعتبرون ديساتوريشن 94 وتحت, بس بعدين وراها قالوا لا انه حتى المودريت كيسز ممكن يستخدمون بها الريميديسيفير. فهسه مودريت وسيفير كيسز احنا نقدر نستخدم بها الريميديسيفير.
واضح عاشت
ايدك.
دكتورة ليلى، دكتورة زينب،
نعم.
إذا عندكم أي شيء. دكتورة ليلى.
لا عاش سيدك سارة.
ايدك عمي.
اي هم هذول اللي يستخدمون حاليا، يعني ماكو شيء جديد، بس يعني عاشت سيدك على المحاضرة.
تسلمين عمي، تسلمين.
بس العفو، ممكن سؤال؟
عيني. اي تفضل.
تفضل.
تفضلي
دكتورة
زينب.
سارة، ممنونين منك.
عفوا.
بس الانكسوبايرين الدوز يعني شلون نقدر نحدده؟
هو اللي كاتبيه بالبروتوكول مالتنا مال انه من 4000 الى 8000، بس عم وليد ذاك المره قال حسب السيفيرتي اوف ذا ديزيز. عم وليد
عدي دايمر مو عم نعتمد احنا لازم؟
اي
اي
تريدين اوضح ساره لو
إيه، عم
توضحين انت؟
لا عم
اي الموضوع كالاتي، شافوا انه اكو كوفيد 19 ريليتد كواجولوباثي، وهوايه دا يسوي لنا مشاكل بالامبولايزيشن، فصار كلش اسينشال انه احنا نحط انتي كواجولات. هوايه ناس مثلا يقول لك انا مثلا اوريدي على مثلا بلافيكس او مثلا اسبرين او كذا، لا، هذول البلافيكس والاسبرين هذول انتي بليتلت، لازم انتي كواجولانت. نبدي اذا كان الدي دايمر less than 0.5 نبدي بروفيلاكتيك دوز اللي هي 50 international unit per kg single dose. هذا اذا كان اقل من 0.5. اذا كان اكثر من 0.5 لازم نبدي ثيرابيوتيك. الثيرابيوتيك هذا 100 international units او 1 جرام per kg 2 times daily. يعني واحد اذا وزنه 60 كيلو مثلا ياخذ 6000 مرتين يوميا. هذه تستمر 5 to 10 days، ووراها يحول الى اما على النواك او الدواك هاي النيو ايجنتس اليوم حكينا عليها ساره، تمام؟ قلنا اللي هي الدايركتلي اكتنج انتي كواجولانت، مثلا زارلتو او بارادكسا. الزارلتو الدوز مالته 15 ملي جرام للادلت، 15 ملي جرام سنجل دوز فور 1 مانث، ووراها راح يعيد بي تي اي ان ار ودي دايمر. احتمال نحتاج 3 مانثs يوز اوف انتي كواجولانت. هذا الموضوع جدا مهم. هو شنو تسلم، هو شنو ورا ما هسه العالم افتهم الديزيز. الحقيقه هي الريكفري ترايل، يعني لما انضافت الانتي كواجولانت والستيرويد وصارت توجه نحو البدايه بالانتي فايرال as early as possible، كلش غير من صوره الديزيز والتعامل مالته، والديث ريت كلش قل، لان العالم تقريبا افتهم الديزيز